You're very welcome. Thank you for coming back. It's Wednesday the 6th of January. Now, there will be some good news later on in this video about the developing vaccination programs. But I'm not going to pretend that the news for the most part of today's video is difficult. But I think we do need to be appraised of the reality of the situation. Now, I'm going to start off, unusually today, with the Republic of Ireland. Many of us have ancestors, of course, from the Republic of Ireland. There's Irish connections all around the planet. And it's a bit of a microcosm, really, of what's going on in several other countries. So I thought it was a really good example. Plus, of course, it's a beautiful country and we are concerned for the people there, as everywhere. Now, this is the graphics here from... That's the official Irish government website. Do check that out for interesting information. But let's just look at this first wave. And then this sort of second wave here in October. But I mean, just look at this recently. I mean, that is just incredible rate of increase here. Absolutely going off the scale, exponential increasing cases. And just to illustrate it again, using a slightly different type of graphic. Here we have this. So this is the recent increases here. And now the rate of increase is virtually vertical, isn't it? It's just really increasing massively. Now, the problem is this rate of increase can carry on. But health services won't be able to cope with this rate of increase. It is that simple. It is that simple, and that's kind of a theme for today's talk, really. Mr. Colm Henry, Chief Clinical Officer, Health Service Executive in the Republic of Ireland, advising everyone to treat others as if they had the virus. Of course, the increase is exponential. It's accelerating rapidly. And we know the virus is out of control. So again, for senior medical officers to be using such terminology as out of control really means that the virus is out of control. They don't use this terminology lightly. More from the Republic of Ireland. This is the Chief Medical Officer, Dr. Tony Holohan. Unfortunately, we expect this to get worse before it gets better. So things are getting worse in the Republic of Ireland. Our health system will not continue to cope with this level of impact. So at the moment, the health services in Ireland are just about coping, the admissions they're getting. But all these new cases, as we've seen, this sort of level of increase here, this is going to feed through into hospitalisations in 2 weeks' time. And if they're struggling at the moment, what on earth is it going to be like 2 weeks after these kind of spikes? The short answer to that question is I don't know. It's going to be really, really difficult. We've also seen a significant increase in positive laboratory tests in recent days, reflecting a true increase in the incidence of disease. So it's not just due to testing. There's an increased positivity. The proportion of tests coming back positive has increased. This is a genuine increase. Now, Republic of Ireland, non-essential shops closed, travel limit 5 kilometres, restrictions on household gatherings, schools staying closed. The question is, at the moment, this doesn't seem to be enough. So what is going on here? Well, we've got the delayed effect, of course, from Christmas and the New Year, which we've been anticipating all around the world. We've been bouncing up and down about this for the last month now, and unfortunately this is now we've got the saying in English that your chickens come home to roost. We're suffering the consequences of this now, unfortunately. Now, is what proportion of this in Ireland Southern Ireland is due to the new variant in the Republic? Well, the 16 diagnosed cases officially, last time I checked, but I've been getting up-to-date news from my contact in Southern Ireland, in Republic of Ireland, Pat, And he says that the Minister of Health is now saying it's 24.9% of the cases in the Republic of Ireland are the new variant. Now, if that's confirmed as being the case, and perhaps been reliable so far, then that is going to continue to increase, because this is exactly what we saw in the mainland of the UK not that long ago, and now where I am, for example, in Cumbria, it's 75%. In London, it's about 95%. Now, staying with the Republic of Ireland, limited capacity, relatively small population to other countries, but estimated ICU bed capacity 230 to 350. There's arguments about it. Probably not able to staff much more than 250. And flights between the UK and Ireland have been resumed inexplicably. So why on earth have they done that? I have no idea. But so basically what we're seeing is this level of increase in cases in the Republic of Ireland is going to feed through into hospitalisations and deaths. Now, my prediction, unfortunately, is for this, that this means that people that could have otherwise survived when this surge of hospitalisations occurs in a week or two's time, people that otherwise could have survived are not going to survive. I don't see any alternative to that, really. It's going to be a massive challenge for the Republic of Ireland. So illustrates what's going on in other countries, and all we can say in the Republic of Ireland is we wish you well, but it is going to be a difficult, very difficult time for you. There is no question. Now, moving on to the United Kingdom, the other part of the British Isles. This is the COVID symptom tracker app. Now let's just look at so basically getting on for 70,000 new symptomatic cases in the day. Symptomatics are only part of it. We need to add 20% of that for the fully asymptomatics. And this is the prevalence that they're estimating now. 6th of January, 785,152 individuals with symptomatic COVID-19 disease in the that's in the United Kingdom, so that's Northern Ireland, Wales, Scotland and England. Now the cases, as we see, this is the last 24 hours. There'll be another figure out actually as I'm making this video, but over 60,000 new cases per day. Hospitalisations also increasing, currently 23,857, 1,847 ventilated. Previous peak was the 12th of April. We are now much higher than the previous peak. Deaths, another 830 deaths in the past 24 hours. That is people that have died within 28 days of a positive test. This is the figure from the death certificates, and that will be updated tomorrow. So we can expect another perhaps 4,500 deaths to be added to that tomorrow. Going on to the official site from the UK, we see the dramatic increase in cases by date reported. And we know that these are going to feed through into hospitalisations, as we've looked at many times on this channel. So let's just look at the healthcare provision. So we see over 3,000 patients admitted there in the last 24 hours. 23,857 currently hospitalised. They're the daily increase in cases, and they're the total number in hospital, and we see it's well ahead of the previous peak. We had been anticipating, I had predicted that this peak would not be as high as this peak. And I was right about that, apart from the fact that I was wrong. I was right based on predictions with the old variant, but the new variant, because of it's 55% more transmissible, means that I failed to account for that. So the hospitalisations are now higher than they were at the peak. And death rates are increasing as well, and will carry on doing so, as we see here. 7-day rolling average. We get that anyway. We can see that they're greatly increasing. So that's the position in the United Kingdom. Now, another way to emphasise this is these were the figures from the Office for National Statistics for the week the 12th to the 18th of December. So 1 in 85 people in England had the infection, 1 in 60 in Wales. Scotland, it was 1 in 140. This is going to increase to 1 in 50 tomorrow, when the ONS publishes their data tomorrow. So 2% of the population of the UK are currently infected with SARS coronavirus 2. And last week, 1 in 4 deaths involved COVID-19, and that will increase over the next few weeks because of these increase in numbers that are now baked into the statistics. Now, moving on to the United States, let's have a quick look at the CDC trends. Again, pretty well as we've been anticipating for some time, we're now seeing the data start to feed through after the holiday period, and that's going to carry on. Increasing. So 7-day moving average, 214,000 new cases per day. And we can look at the deaths in the United States as well. And again, we see the increase, delayed in reporting deaths, but that's going to carry on increasing now because that's going to follow the trends. So we see really very similar trends in Republic of Ireland, United Kingdom, and the United States. Different scales, but based on their population sizes. So that was the cases in the last 24 hours, over 20 million diagnosed, nearly 21 million diagnosed cases now. That's up another 7.8% in the past 7 days. Hospitalisations in the States now stand at an unsustainable 131,195. 23,509 in intensive care. Just under 8,000 ventilated. Deaths now stand at basically 350,000. Now, to illustrate what this means in terms of real people's lives. Now, I've just got this from some popular news outlets in the United States. So, Los Angeles County is running out of oxygen is the headlines. Army Corps of Engineers being called in to try and engineer up more oxygen. Now, I read this headline here: ambulance crews instructed to use oxygen only for the worst case patients. So I've just done a bigger copy of that actually so we can see this. I don't have time to chase back every reference, but I did chase back this one. So Emergency Services, Los Angeles County Board of Supervisors. So this is appears to be the official. I've put the reference for this, of course. Check this. So what they're saying here is, given the acute need to conserve oxygen, effective immediately, emergency medical services should only administer supplementary oxygen to patients with oxygen saturations below 90%. For patients with hypoxia, oxygen saturations less than 90%, the minimum amount of oxygen necessary to maintain the oxygen saturations at or just above 90% shall be administered. In other words, what they're saying is, so normally we would titrate oxygen levels to 94 to 98% would be normal. Here they're saying titrate it to 90%. And what they say here is, the rationale here is, an oxygen saturation of 90% is sufficient to maintain normal tissue perfusion in most patients. Now, I would hope that the clinical staff here would use their discretion, of course. But I think it just goes to show that there are real logistical difficulties there. Now, we've looked at oxygen saturations quite a few times on this channel, so let's just have a quick look at that. So this is my SATS probe. We use these every 10 minutes at work. It's absolutely standard. So you just put your finger in and it measures your heart rate and your blood oxygenation. So how am I doing? Maybe go around that way. There we go. So my heart rate at the moment is 80. Give it a little while to settle down. 86 beats per minute. And my oxygen saturation is 98%. So what they're saying in Los Angeles County is they'll accept 90 as being good enough to get enough oxygen to the tissues. And to be fair, clinically, this is reasonable. I mean, if I'm at work and someone's oxygen saturations are 90%, I would certainly raise it with senior medical staff. I'll get the consultant to see them, but it's not a complete emergency panic situation. Well, you don't panic in emergencies anyway, but it's not a severe emergency life-threatening situation. So I can see what they're getting at here to conserve oxygen. So when your oxygen saturations are 100%, what that means is that your blood is carrying 100% of the oxygen it can possibly carry. Every red cell is saturated with oxygen. If your oxygen saturations are 90%, then that means that 10% aren't saturated with oxygen, 90% are. But that's enough to maintain good tissue perfusion. So it's fair to say that I don't think anyone would develop sort of blue cyanosis with saturations of 90%. That would come at much lower oxygen saturations. So it's just interesting to check these facts back sometime, and that one does check out. So that was that. Not to bring patients to the hospital if they have little or no hope of survival. Now this one is a bit frightening. Now this is from the Washington Post. So how accurate all I'm doing is saying what's in the Washington Post. The thing that concerns me here is if this is paramedics and ambulance crews doing this assessment, that they might think that someone is iller than they are and not bring them into hospital, which I think means leave them at home to die, doesn't it, really? Reading between the lines of this. Now, even for very senior experienced medical staff, doing a quick assessment is often not enough to decide. If we're uncertain in an accident and emergency situation, for example, if someone is in a survivable situation or not, we would normally pass that decision on to intensive care consultants to make that decision. So and it can take them some time to make the decision. So I think I don't know. Anyway, this shows how serious things are in Los Angeles County. And apparently, Washington Post is reporting ambulances have been turned away. So this is what we've been fearing for some time now. Now, where is the situation worst? Well, the hospitalizations, Arizona's highest rate of coronavirus hospitalizations. Atlanta area, Georgia, every hospital is almost full apparently. Field hospitals are reopening in Georgia as far as we know. And these are the areas, the south and west are the areas with the highest hospitalizations. So these are the areas with the highest per capita hospitalizations. So we're seeing a deadly result of holiday gatherings. It's starting, but the main party is yet to arrive. Exactly as we anticipated, and yet we looked yesterday at all those millions of Americans that chose to fly around. We looked at 115 million on the move over Christmas and New Year. The results are now inevitable, and this is what we're seeing. People are going to die in increasing numbers as a result of this. And given the increasing stress on hospitals, it's really hard to see what's going to happen. Okay, emergency hospitals are being opened, military are being deployed, but it's not clear in the Republic of Ireland or the United States or the United Kingdom what is going to happen in January and February, with an awful lot of people requiring medical services all at the same time. It is not clear what's going to happen. Epidemiologist George Mason University, and all the signs point to things getting a whole lot worse before they get better. Sad but true. I believe that is consistent with my understanding. Now, just a point about infections here. People who might have picked up the infection at Christmas Now, typically the incubation period, of course, for SARS coronavirus 2 is 5, 6, 7 days, 6 days typically. So we've got exactly a week between someone who could have caught the virus at a Christmas party and then went to a New Year's party. Now, at 7 days, they're likely to be minimally symptomatic or asymptomatic, but of course people are most infectious the 48 hours before and the 48 hours after symptoms start. So this means there would be a lot of people who picked it up on Christmas Day, who passed it on, who were most infectious on New Year's Day when further social interactions, albeit against much advice, were taking place. It's a bad timing between the two. Ideal for the virus, pretty terrible for us, I'm afraid. What's happening with a new variant in the United States? Well, as we said, CDC dropped the ball on this one somewhat, many would say. But now we know it's in Colorado, California, San Diego County, 32 cases of the new variant. Florida, New York and Georgia now added to the list. So can there be any doubt that the new variant, sometimes called the Kent variant, sometimes called 2012, in the States called B117, it's the new variant that was first identified in the UK. We don't know where it originated. It could have originated in Kent. We simply don't know. That's just where it was first detected because the UK has high surveillance. This means that this is spreading in the community in the United States. I think we can now conclude that. I still hope I'm wrong. I hope these are remarkably isolated cases. But I don't think I am, and that means the rate of spread in the United States will carry on accelerating. Why am I saying that? Because that's exactly what happened in the UK. Our numbers are going exponentially high because of this new variant, largely because of this new, more transmissible variant. Right. Oh, right, okay. Let's just have a look at global vaccinations quickly now before we look at the argument. So United States, as we said, Operation Propulsion Power, not particularly impressive. Not the warp speed we were hoping for yet. Let's hope that increases. So unimpressive start in the United States, but Canada looks even worse. I mean, dear me. UK were up to about 1.3. What are we saying? UK 1.9 doses given per 100. Yeah, okay, 1.3 million doses altogether. Now we know Israel. Yesterday we talked to the doctor from Israel. Where are we up to now? 15% of the population in Israel. Also, Bahrain was doing particularly well. 4.3% of the population, and Oman, that's good. Oman's made a good start. France is now up to 2,000 doses, so they pretty well quadrupled their total. They've now vaccinated 0.0031%. Germany a bit better. UK we've looked at. Okay, so that's just a quick sketch of what's going on globally. Needless to say, there's whole swathes of the world, surprisingly it must be said, including Australia and NZ, that haven't started yet. Oh, that's interesting. So they made a start. Yeah, we talked about that, Argentina and Chile. We talked about that about a week ago, didn't we? So that start being made there. Now, there's a bit of a debate going on. So to sketch this out, it's not a debate really, but the UK are stretching out the gaps between the doses, and the United States have decided not to. So let's look at this now. So vaccination administering protocols, Food and Drug Administration, on following the authorised dosing schedule for COVID-19 vaccines. So this is the FDA. Basically, they've decided to leave everything as is. They're not changing it. Without appropriate data supporting such changes, that is making a wider gap between the two doses or altering the doses. Such changes in vaccination administration run a significant risk of placing public health at risk. Pretty strong language there, pretty strong language. So the Pfizer-BioNTech remains at 21 days between doses. The Moderna one remains at 28 days between doses. So what we see is the clear blue water opening up between the United States and the United Kingdom in terms of vaccine strategy, because in the UK, remember, statement from the Chief Medical Officer, prioritisation of first dose of COVID vaccines. So we're trying to get as many first doses out as we can to keep as many people out of hospital as we can, because we know after the first dose people are much less likely to get sick. And in the case of the Oxford vaccine, it looks like it's providing almost 100% protection against getting sick. Of course, the Oxford vaccine is not being used in the United States. The FDA have not authorised it. The Moderna vaccine is not authorised in the UK either, but it's irrelevant because we're not getting any until March anyway. So that's why there's no rush for that in the UK. But anyway, bearing in mind the dosing strategies for the United States, the intervals. So Medicines and Healthcare Products Regulatory Authority, our MHRA, and agreeing with the Joint Committee on Vaccination and Immunisation. So these are the definitive bodies in the UK. I've gone a different way to the United States, no two ways about it. Oxford AstraZeneca, 2 doses 4 to 12 weeks apart. Pfizer 3 to 12 weeks apart, advising that the second dose be given near the end of that period. So which is the best strategy? Well, the FDA is saying stick to the 3 weeks and the 4 weeks between injections. We're saying no, stretch it out to cover as many people as possible, doubling the amount of people you can immunise, or not immunise, partly immunise and prevent from going to hospital in the short term. Who's right? Well, I'm not going to settle an argument between the HMRA and the Joint Committee on Vaccination and Immunisation and the Food and Drug Administration. That's for sure. But I would say in the UK, I really don't think we've got any choice. Because if we don't, hospitals are going to be overwhelmed. In the UK, I really believe we have no choice but to follow this strategy. And note, I'm not commenting on the US. I'm not sufficiently informed to do that. Joint Committee Vaccination and Immunisation, JCVI, they're saying we'll protect the greatest number of at-risk people overall. That is spreading out the doses so more people can be given the first dose in the shortest possible time to keep them out of hospital. Greatest impact on reducing mortality, severe disease and hospitalisations, and in protecting the NHS and equivalent healthcare services. So I really believe that what we're doing, the United Kingdom, doesn't have an acceptable choice. Second dose of both vaccines will be administered towards the end of the recommended vaccine dosing schedule of 12 weeks. So there we are, clear difference between the two sets of advice. Vaccine trackers we've got there, we've looked at some of those. I include the links, of course. Click away, and it is remarkably interesting, and pleased to say that we've added Italy to the list. So Italy has now got its vaccine tracker. The UK has not. We are promised something like this for Monday, but we don't have one yet. But these maps do give a lot of accountability to governments and those in charge of these programmes. So I'm all in favour of them. So Italy, for example, we can see, we're going to light up, yeah. So Sicily has given 29,258. And we can look at the different regions in Italy and how they're doing. And we have got this for the States as well. I've included the link. And there is quite a big difference in how individual states are getting on. Now, I think that's about all I was going to say today. I'm just going to show you something. This is interesting. Now, this is just a public domain picture from Wikipedia, but it's a genuine picture from 1976. And what we see, this guy here has got these injection guns, and what it does, it injects some air, psst, like that. But it does it so quickly, it goes straight into the muscle, so you don't need a needle. And this has been used in mass vaccination campaigns in the past. And I'm just wondering, you could clean it with iodine in between patients, but you could go psst, clean, psst, clean, psst, clean. You know, you could do it really, really quite quickly. I'm just wondering if governments are considering this at the moment. I'm not advocating or not, but I think it's something worth considering. This was used with huge success in the eradication of smallpox, that wretched disease of smallpox. So I thought that was interesting. So it's called a jet injector. And this picture, apparently during the national swine flu vaccination campaign, which began on the 1st of October 1976. I remember that. It was a really good summer, 1976. Spent quite a bit of time swimming in the river in between night shifts, as I recall. This rare influenza strain, HSW1N1, so that was the type, influenza virus, was reported among soldiers at Fort Dix, New Jersey, where one patient died. A very similar strain killed 500,000 people in the United States and more than 20 million people worldwide in the 1918-19 pandemic. Probably way more than 20 million, actually. In response to the 1976 outbreak, in order to prevent another epidemic, 50 million Americans were vaccinated during a 10-week period. Right, listen to this. This is interesting. In 1976, 50 million Americans were vaccinated during a 10-week period. Now, Mr. Biden has, I don't know if he's pledged, but he says he wants 100 million vaccines in his first 100 days. So the United States has shown it is capable of this, and I really wish Mr. Biden's campaign success with that. But here we have this simple fact that 1976, United States, 50 million Americans were vaccinated during a 10-week period, setting an immunisation world record. Let's hope we can set an other immunisation world record in the next months ahead. Now, I hope you managed to listen to Dr. Billick's report yesterday from Israel. So I've just got a few pictures that he's kindly sent in. If I have the technology. Of course we do. There we go. So here's the vaccination centre. We see all these cubicles with people vaccinating away. We know Israel's done particularly well. Ordered queue to get in. Inside, good distancing. These will be family groups, and this is hopefully good ventilation. Good social distancing outside the centre. I did have one. Oh, that one's a video. Let's just watch that.
מספר 516 לעמדה מספר 5 מספר 453.
So I just thought that was quite interesting. Am I going to focus here? Let's try that camera. I don't know why that one's not focusing. There we go. We're in focus again. I don't want to be out of focus. Let's just have a few pictures now. This is from Rhonda. Now, Rhonda has been vaccinated with the Moderna vaccine in the States, and I'm impressed that there's good follow-up. Now, I assume all the vaccines, there's only 2 vaccines in the States at the moment, the Pfizer and the Moderna. I assume they're doing similar follow-up. But it's good that they have this follow-up data. So she has to say how she's feeling, just via an app, and fever check after the vaccine, symptom checker after the vaccine. So that goes up a bit. Anyway, I think Rhonda was doing fine. That was the main thing I was trying to write. Oh, there we go. Health impact. None of the above. Been unable to work, been able to do your normal daily activities. Get care from a doctor, none of the above. So I'm delighted to see that Rhonda's doing well. So that is very good follow-up, and I would assume that is all being collected as good quality data on a national scale. So that's good news. So don't forget, if you live in the northern latitudes, it's dark. Do consider with Winston taking your vitamin D. I've taken mine today. I've taken 50 micrograms of vitamin D today because I believe it's an important immunomodulator. Okay, that is us. Thank you for watching. Of course, as always, it is a difficult time. The vaccines are coming to the rescue. We will get through this, but unfortunately there's going to be some people getting, a lot of people getting sick and some deaths, quite a few more deaths in the next month or two. And then things will start getting dramatically better, at least in Western countries, as the vaccines kick in March and April. That is my current hope and belief. Thank you for watching.